Today, we're going to explore Histrionic Personality Disorder, HPD, a condition where individuals constantly seek attention and exhibit dramatic behavior. People with this disorder often become the life of the party, always striving to be the center of attention. HPD is distinct from borderline personality disorder, BPD, although they share some characteristics. While BPD involves intense emotional instability and a profound fear of abandonment, HPD is more about seeking attention without the deep emotional turmoil. People with HPD aren't fixated on forming deep bonds. They just want to be noticed by anyone available. Their emotions can appear shallow and change rapidly, unlike the intense mood swings seen in BPD. Individuals with histrionic personality disorder, HPD, exhibit pervasive attention-seeking behavior as a core feature of their personality. This manifests in a variety of ways, such as consistently seeking the spotlight in social situations, being overly dramatic in their expressions, and striving to be the center of attention at all costs. They often use flamboyant gestures, provocative clothing, or exaggerated stories to capture the focus of those around them. This behavior isn't necessarily rooted in a deep desire for genuine connection, but rather in the immediate gratification of gaining attention. For instance, they might dominate conversations with exaggerated anecdotes or use seductive behavior to draw others in. This constant need for validation and admiration can strain relationships, as others may feel overwhelmed or manipulated by the intense focus on the individual with HPD. Despite the outward appearance of confidence, individuals with HPD may harbor insecurities about their self-worth, relying on external validation to bolster their fragile self-esteem. Another characteristic of HPD is the display of superficial and shallow emotions. People with HPD often present themselves in an overly emotional manner that lacks depth or authenticity. They may exaggerate their feelings to elicit sympathy or to maintain the attention of others. This emotional volatility can be confusing for those around them, as it fluctuates rapidly and unpredictably. Despite the intensity of their emotional displays, individuals with HPD may struggle with genuinely connecting on an emotional level with others. Their relationships tend to be fleeting and lack the depth typically associated with meaningful connections. This superficiality extends beyond emotional expression to encompass their interpersonal interactions and communication style. They may use vague language or grandiose statements that lack substance, preferring to keep the focus on themselves rather than engaging in meaningful dialogue. Individuals with histrionic personality disorder, HPD, often present themselves in an exaggerated and theatrical manner, both in appearance and behavior. This includes attention-grabbing clothing choices, provocative attire, and a tendency to engage in overly seductive or flirtatious behavior. They may use their physical appearance as a tool to capture attention, relying on their attractiveness or perceived charm to maintain interest. This exaggerated presentation extends beyond clothing to encompass their overall demeanor, which can be described as flamboyant or overly expressive. For instance, they might use dramatic gestures, facial expressions, or vocal intonations to emphasize their points or to elicit a reaction from others. However, beneath this outward display of confidence and charm often lies a deep-seated need for validation and approval. Despite their efforts to appear self-assured, individuals with HPD may experience fragile self-esteem and rely heavily on external validation to maintain their sense of self-worth. In interpersonal relationships, individuals with histrionic personality disorder, HPD, often exhibit distinct dynamics that can be challenging to navigate. They tend to form superficially close relationships quickly, often mistaking acquaintance for intimacy. This rapid establishment of closeness can lead to misunderstandings and frustrations when others do not reciprocate the same level of emotional investment. Their interactions are characterized by a desire to be admired and appreciated, with a strong emphasis on gaining attention and validation from others. However, these relationships are often unstable and lack the depth and reciprocity found in healthy connections. People with HPD may become easily bored or dissatisfied with relationships that do not consistently provide them with the attention they crave. As a result, they may seek out new social connections or engage in attention-seeking behaviors to fill this perceived void. This pattern of behavior can strain relationships and lead to feelings of frustration or resentment from others who may feel used or manipulated. While histrionic personality disorder, HPD, manifests similarly in both men and women, there are notable differences in how it is expressed based on gender norms and societal expectations. Men with HPD may emphasize their wealth, status, or achievements as a means of gaining attention and admiration. They may engage in grandiose behavior or display material possessions in a conspicuous manner to establish their social standing and attract attention. This emphasis on external markers of success is a reflection of societal expectations around masculinity and power. In contrast, women with HPD may focus more on their physical appearance, using attractiveness, seductiveness, or femininity to captivate others. They may use provocative clothing choices, makeup, or grooming habits to draw attention to their appearance and maintain a sense of desirability. This emphasis on physical appearance is often influenced by societal expectations around femininity and beauty standards. Despite these differences, the underlying motivation for attention-seeking behavior remains consistent across genders. Both men and women with HPD seek validation and approval from others as a means of bolstering their fragile self-esteem and maintaining a sense of self-worth. Histrionic personality disorder, HPD, often coexists with other mental health disorders, contributing to a complex clinical picture. One common comorbidity is with mood disorders such as depression or anxiety. Individuals with HPD may experience depressive episodes triggered by perceived rejection or failure to receive the expected level of attention. Similarly, anxiety may arise from the constant need for approval and fear of being ignored or overlooked in social situations. The presence of mood disorders can exacerbate the symptoms of HPD and complicate treatment approaches, necessitating a comprehensive assessment and integrated treatment plan. Another frequently observed comorbidity is with other personality disorders, particularly borderline personality disorder, BPD, and narcissistic personality disorder, NPD. Like individuals with BPD, those with HPD may struggle with unstable self-image and intense, unstable relationships. However, while individuals with BPD fear abandonment and have a core sense of emptiness, those with HPD primarily seek attention and approval without the profound fear of abandonment. On the other hand, similarities with NPD include grandiosity and a strong desire for admiration, but individuals with NPD emphasize superiority and entitlement, whereas those with HPD focus more on being noticed and appreciated. Substance use disorders are also common among individuals with HPD, as they may turn to drugs or alcohol to cope with feelings of inadequacy or to enhance their social performance. This dual diagnosis can complicate treatment outcomes and requires addressing both the underlying personality disorder and the substance use issues concurrently. Histrionic personality disorder, HPD, significantly impacts various aspects of an individual's life, often leading to impaired functioning and reduced quality of life. In social and occupational settings, individuals with HPD may struggle to maintain stable relationships or hold down steady employment due to their attention-seeking behaviors and emotional volatility. Their exaggerated expressions and need for constant validation can alienate others and disrupt team dynamics or workplace harmony. In personal relationships, the superficiality and instability characteristic of HPD can result in frequent conflicts and difficulties in establishing lasting connections. The intense desire for attention may lead to manipulative behaviors or emotional manipulation to maintain control over others' perceptions and actions, further straining relationships and causing distress for both parties involved. Despite their outward appearance of confidence and charm, they may struggle with feelings of emptiness or inadequacy when not receiving the desired level of attention or admiration. This internal conflict can contribute to emotional distress, mood fluctuations, and even symptoms of depression or anxiety. Overall, the impact of HPD on functioning and quality of life underscores the importance of early recognition, accurate diagnosis, and comprehensive treatment interventions. Treating histrionic personality disorder, HPD, requires a multifaceted approach that addresses both the core symptoms of the disorder and any associated comorbidities. Psychotherapy, particularly cognitive behavioral therapy, CBT, is often the primary treatment modality used to help individuals with HPD understand their maladaptive behaviors, challenge distorted thought patterns, and develop more effective coping strategies. Through CBT, individuals can learn to identify triggers for attention-seeking behaviors, explore alternative ways of seeking validation, and improve their interpersonal skills. Dialectical behavior therapy, DBT, is another effective therapeutic approach that combines CBT techniques with mindfulness practices to help individuals regulate their emotions, manage interpersonal conflicts. DBT emphasizes acceptance and change strategies, teaching individuals with HPD to balance their intense emotional reactions with more adaptive coping mechanisms. Group therapy can also be beneficial for individuals with HPD, providing a supportive environment to practice social skills, receive feedback from peers, and learn from others' experiences. Pharmacotherapy, such as antidepressants or mood stabilizers, may be prescribed to manage co-occurring mood disorders or symptoms of anxiety and depression. However, medication alone is typically not sufficient for treating HPD and should be used in conjunction with psychotherapy and other supportive interventions. Family therapy or couples counseling may be recommended to address relational dynamics and improve communication within interpersonal relationships affected by HPD. Overall, a comprehensive treatment approach tailored to the individual's specific needs and circumstances is essential for effectively managing histrionic personality disorder, enhancing emotional stability, and promoting overall well-being. By addressing both the core symptoms of HPD and any coexisting mental health issues, individuals can achieve significant improvements in their interpersonal relationships, self-esteem, and quality of life. If you found this video insightful, please subscribe, comment, like, and share our channel to your loved ones. Stay blessed and irresistible.